deal with an under-resourced community, and this one happens to be Latino. And that's not for any specific reason other than the need. And so I'm an ER doctor, and that's what I do full time. And you get trained to salvage lives and deal with some pretty horrific things. But when you see a 15-year-old kid shot in the chest, these are things that you're seeing happening to children, and you say to yourself, well, we're dumping all of this money into the end result. We got to start thinking, go upstream. The fight's not in my ER. The fight's out in the community. The full-on, sense of what the capacity for this space was, it really actually escaped me. I just saw it as space and obvious rooms. And so they immediately saw the potential with that space up there and the facade along South Street of opening it up and creating this atrium kind of effect. And they actually came and toured not only this physical space, but they met with our partners and people we collaborate with in the community who added, an additional sort of perspective on the space, the spatial needs. And that was really cool. And understanding how sort of holistically what Puentes is building is this health and wellness center, and that by sort of dismantling and then reconstructing and reconfiguring, the space here is almost perfectly suited for our needs. This space represents, for me personally, the final, the sort of keystone piece of Puentes. That's the over the lintel. You drop that piece, and it locks it in place, because we're going to be finally able to expand our clinical care to 5 days a week. With it opening up its doors, running clinics daytimes and evenings, boom, all of a sudden we can realize that aspect of our mission. But along the way, you start bringing in all of the other educational pieces. So you use healthcare as the hook that brings people to